Hey everyone, get ready for a hands-on look at essential casting and splinting techniques with Sarah Barlow, a physical therapist turned orthopedic PA and a proud UTRGV PA alumna. We're covering short leg casts, short arm casts, and short leg splints, plus all the gear you'll need. So stay tuned. Casting and splinting are essential procedural skills that every PA should be familiar with. These techniques come in handy across a wide range of clinical settings, including orthopedics, emergency medicine, urgent care, family medicine, and sports medicine, where immobilization and injury stabilization are often very necessary. In this video, you'll learn from Sarah Barlow, PT and PAC, a former physical therapist turned orthopedic physician assistant, and a proud alumna of the UTRGV PA program. Sarah will demonstrate a short leg cast, a short arm cast, and a short leg splint using Ortho-Glass. We'll also go over the equipment and materials that are needed for each application. If you're a student, this video is designed to help you get familiar with proper techniques and tools before your workshop or before working with real patients during clinical rotations. Let's dive in. All right, so before we get into the demonstrations, let's take a look at what kind of equipment we'll need for casting. So each student will be provided one of these bags, and inside these jumbo bags, we have the casting materials needed to do a short arm cast and a short leg cast. So let's go through it so we can divide those up. For the short arm cast, we will first get a 3-inch wide stockinette. Okay, so this is what will go on the arm first. So I'll set that over here. Then we'll have 2 rolls of 2-inch cast padding. Okay, and 1 roll of 3-inch cast padding just in case. And then we will have 2 rolls of the 2-inch casting tape. Okay, so those will be for the short arm cast, as well as 1 roll of the 3-inch casting tape. And so this will go together. You might not need all of these to do a short arm cast. It really just depends on the size, the length of the arm that you're doing the cast on. But this is the equipment that you'll need for the upper extremity cast. Now moving down to the lower extremity cast, let's take a look at what's in here. So we have a larger stockinette. It's a 4-inch stockinette, and it's a little bit longer for the lower limb. We'll have 1 3-inch padding. We'll have 2 4-inch paddings, and then we'll have 3 casting tapes. We'll have a 4-inch, another 4-inch casting tape, and then the last but not least, a 3-inch casting tape. Now again, you might not need all of this equipment to do your cast for your workshop, but this is kind of extra. You have everything that you will need in this bag. Now, one thing I forgot to mention that I found towards the end is this. So this is a little thumb stockinette, and this some providers use to kind of brace or to protect the thumb when they do a volar cast. So this will be in there too. I'm not sure if our demonstrators are going to be using it or not, but it's good to have just in case. Okay, so that's the casting material. Now let's go look at what we'll need for splinting. All right, so for splinting, we're going to use Ortho-Glass. So you'll see that rolls of this Ortho-Glass are placed in the classroom or in the laboratory that you'll be working in. And you'll see on the box, it has a number. This is 4-inch. It's 4 inches wide. This is what we would probably use on a lower limb, whereas this one has a 3, it's a 3-inch. So it's a little bit less wide, and that's what we'd probably use for an upper limb splint. Other things that you'll need for this is some cast padding. So the same cast padding that we had placed for your casting. And then you'll need ace bandages. And these ace bandages are reusable, so they'll be placed kind of right by where we have the Ortho-Glass material. And the ace bandages, you just open them up, and they have some Velcro on them that'll help you secure it. A pro tip that I would say is if you're doing all the work to use the stockinette and to wrap with the cast padding, I would recommend going ahead and putting a splint on first with the H-wrap, because then you can go ahead and remove the splint portion, and you're already set up to do the cast right after that with the same cast padding and the same stocking end. So that's just something to consider when you go to your workshop. One other thing to mention is when we are working with Ortho-Glass, Ortho-Glass has fiberglass on the inside, and as soon as that fiberglass is exposed to the air, it starts to harden. And so if we don't properly store this, you'll notice even this one wasn't stored very well, or maybe it's been stored for a long time, is all of this starts to get hard. So pretty much everything from here down is hard. And so one thing that's really important is that when we're done using it, that we fold the end of the Ortho-Glass up inside of here, and then we place this, looks kind of like a movie director, but we want to fold this in and put this on there so that the Ortho-Glass that's in there stays fresh and soft for the next student that wants to use it. So that's one thing that's really important to do. Don't leave it open for a long period of time. You'll also need some scissors to cut it. 1 second. We have some really big scissors that we'll be providing to y'all. These tend to get a little bit gummy when we cut this, so don't use your own scissors. Use these, and if you can, try to clean them off after you're done so that they don't keep that sticky residue. It makes it harder to use in the future. So use this to cut the length that you need. You'll also need, wait, 1 more second. You'll also need one of these. So before you run and cut your length of however much you need to measure your patient's leg or arm. And so I would recommend getting one of these. We'll have them stationed throughout the lab, and you'll want to measure and always get more than you think you might need, or a little bit more, because you can't use it if it's too short, but you can always cut a little bit off if it's too long. All right, so that's pretty much all the equipment you're going to need for both casting and splinting. So now let's move on to look at some demonstrations of both.
Most of the time in the ER, you are going to put a splint on, reason being that a patient is going to swell. They come in with a broken arm, a broken ankle, they are going to swell. So you don't want to put something too restricting on. And most of the time, we do put splints on. I would say 99% of the time, you'll be putting on a splint in the ER. That's either made out of plaster or that'll be made out of fiberglass. And there's different sizes that you'll put on the patient. For wrists, we typically would put maybe about a 3-inch on. It's a little bit smaller. And then for an ankle, you'll be putting on a 4-inch, which is a little bit wider. It gives a little bit more support. This will allow the patient to swell naturally, which is what you want, because if you put on a cast, it creates a little bit of a restriction in the blood flow, and then you're looking at compartment syndrome, things of that sort. So you'll put a splint on for those instances. And then once the swelling has subsided and the patient comes and sees you in the clinic or wherever you are, your physician or you might make the decision to put on a cast. And in that instance is where you would be using the casting material, and that's circumferential, so that hardens all the way around, okay? Similarly, you put them on the same steps, just like I said, a splint allows for that swelling, so you'll be using ACE wraps to put the fiberglass on versus the casting material, okay? All right, so for the leg, we'll begin there. When you grab your casting material, so we're gonna be putting on a cast. So the patient came in, her swelling looks great. You're like, all right, we don't need to do surgery. We can treat this ankle fracture with a cast. You're gonna have a couple of things in your toolbox. The first being your sock, okay? Your sock is pretty important because it's gonna protect the skin, all right? You always wanna do a skin check before you put this on, before you put on anything really. You wanna make sure that there's no open wounds. The patient, sometimes your frail elderly patients will have really thin skin, so you wanna make sure that you do a circumferential skin check. You look at the heel, that's very important. And then after that, you'll put on a sock. So I'll have you take off your sock. And perfect. Thank you. And then I just need to use scissors. All righty. So when you put on your sock, usually what I do to measure is I'll get the tips of my hand and I'll come up this way. For a leg, I usually, since I'm a little bit smaller, I'll come right around to like my bicep area. Guys, you probably don't have to do that. But you're never gonna cut off too long of a sock. You can always make it shorter, you can never add on, right? So the longer, for me, the longer the better. So when you put on the sock, let's say, all right, we've made our skin check, she looks great, all right? Of course you do your whole, hi, my name is Sarah, I'm the PA today, I'm gonna be working with you, blah, 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 spiel. We're gonna put on a cast today. You let them know what you're gonna do, and then you guide them through the whole thing. So typically I'll say, all right, we're gonna put on your sock first, and when you put on your sock, you always wanna make sure that you have some room to work with. So we're gonna put on your sock here. All right, you wanna make sure that you're covering her toes initially, and I don't know if y'all can see that, but you're gonna cover her toes initially, and then you're gonna come up. And you want the cast, or the sock at least, to be nice and smooth when you put it on. Now, when your patient comes in, depending on how mobile they are, what you're seeing, sometimes a patient can't sit down like her, right? Sometimes they're just like in a lot of pain and they're like, you know what, I can't do this. If they're a little bit more mobile, I'll have them say, okay, can you lay on your stomach? They'll be belly down, and then you can bend their leg that way. If they can sit up and they can tolerate this, no problem. Some clinics will have a special gadget where they'll slide their foot into like this metal bar, because you want to keep the leg at a 90 degree. This is where you want the patient, okay? So when you put on the sock, you're at a 90 degree. Obviously she's a little bit taller, so I don't think we can come up, but
I can sit on the table.
if that helps. Are you comfortable with that?
Yeah, if that works for you.
Okay, nice and bent at a 90, all right? You don't want to have them in an Aquinas position like this, all right? You don't want to have the foot pointing down. Yep, you're always going to be at a nice neutral dorsiflexion or 90 degree angle, okay? This is where that little apparatus I was talking about, that's where it comes in handy, because sometimes patients get really tired of keeping their foot up like this, especially when they have a fracture. That's really hard. So that's why I say, all right, if you're able to lay on your stomach, that's a lot easier, because for them it's easier to bend their knee, and then gravity can help pull their foot down. But in this instance, we'll have the patient here sitting. I'll have her bring your toes up, and then here is where you're gonna make your adjustments, right? So we're gonna bring this to be over. And you wanna leave a good amount, I would say maybe like an inch or two from the toes covered, because you're gonna fold that part back, okay? Make sure she keeps that leg there. And then here, oh, look at that. We'll leave it a little long for her. And you can have that a little covering the knee, because when you wrap the cast, you're gonna fold this over. So here you wanna make sure all your edges are really nice and smooth. Here, sometimes patients or some techs, depending on who you're working with, they'll cut this little ridge right here, so that way the patient doesn't have any wrinkles. Now in this instance, this sock might be a little too big for you, but we'll work with it. All right. So once you have the patient nice and smoothed out with your sock, then you're gonna grab your casting material. And here you're gonna work distal to proximal, okay? This is always just gonna be laid on the patient. You don't wanna really tighten that, okay? Nice and laid. And layers, layers, layers. Typically we'll put about maybe 4 layers on, especially around your bony prominences. So your heels, your areas most likely to get pressure sores. Your heels, your malleolus. Sometimes this fibular head right here will irritate the patient depending on how far you put up your cast. So you wanna make sure that that is nice and padded as well, okay? So I'll start here. We'll get right where the base of the foot is. We'll wrap. I typically like to wrap twice around, so that would be 1. And that would be 2.
And notice which way she's holding the
Yes.
cast padding, because it's like the toilet paper roll, right?
Yeah. If you flip it over, sorry, it's like second nature now, so I'm like, I don't even pick it up. If you flip it over, you're gonna not be able to wrap it very nicely, okay? So this kind of just glides off your hand. And then you're gonna be going rules of half, right? So 50% here, and you're just gonna be working your way up. All right, go ahead and relax your leg, yeah. And trying your best to not create any lumps, any ridges. And then you just keep going up, up, and up. Now, if this does happen, sometimes I just kind of like smooth that out, and then I just keep going up. It definitely takes a little bit more practice. So once I get my 1, I'll get my 2. So when we say like flipping over, if you try to roll it that way, you're gonna be working against yourself. So you wanna flip it to where you're opening out, okay? Starting at the bottom again. This time I'll only do one. Making sure we get the heel very nice. Wrapping around. Coming here. And then just working your way down. So after this, I usually ask the patient, like, how are you feeling? Anything bothering you? Anything messing with you? Feeling pretty good, not too tight, right? Okay. After that, you're gonna grab your cast material. Usually, it depends on whose hands you use. But typically the rule of thumb is about a 4-inch for the lower extremity and then a 3-inch for the upper extremity, so wrists and all. My hands still aren't the most comfortable with 4 inches just because I have smaller hands, but you'll see most people use 4 inches. You'll open this up, and if you have help, you'll have them get the water, and I'll bring that over here. Lukewarm water is always best because it gives you more working time. If you use cold water, this thing is gonna get really hard on you really, really fast, and so it makes it a lot harder to work with. You'll get nice and wet. Wring it out, and same thing, just like the splint or the cast padding, you're gonna roll it away from you. All right, and you work in the same motion. So this is your base layer. We're gonna put this on here. And then roll it half. And this is already pretty snug on me. So careful not to move your leg for me, just go ahead and relax it. There you go. And same thing, you don't want to make it super, super tight. Once you get up here, you're also going to do twice around. And then you'll start working your way down. Now you might feel this start to get a little warm on you. That's totally normal. And then your second layer is to reinforce all the others. Now here what I like to do is I'll do once around, and this is gonna get a little hard on me already. And then from here, you'll fold this back. I'm gonna try to work as fast as I can because that cast material is starting to get a little tight on me. And then you'll catch and see if we can use this three. This is already getting stick. You'll essentially catch your padding here. same thing, you'll wrap all the way around, making sure we're getting the heel. To get here, you'll fold that over. Around. Just work your way down. I didn't ask, do you guys have soap here or gel?
Soap or gel?
Do you have soap or gel? Or hand sanitizer or something? If not, it's all right.
Great.
Oh, perfect.
I'll take that little.
So then you'll grab some soap. You can also grab gel, and then you'll start molding it. So palms are always best. You're gonna make sure you get out some of the lumps that you probably had, and you wanna make sure you have the patient say, like, keep her toes up. And if you wanna get really fancy with it, you can use the your palm, and you can create like a little divot right there where her arch is, so she's got a little bit of support. And you'll hold that there. Never, ever, ever use your fingertips, because then you create pressure source for the patient, and you don't want that. So palm is best. And the more cast material that you put on, the heavier the cast is going to be, but the more support you do have. So typically we do I will do about 3 layers for a short leg cast. And then I'll work my way up. All right. There are a couple of people who will make like a little V, and when I say V, I'll show you here. They'll cut here, and then they'll use that to wrap around. It's completely your preference. So we'll wrap, rule of half, same thing. So come out just a little bit, and there you go. So I can get that. I'm patting that area once or twice. And then I will come up, making sure that I pad the bony prominences. So your ulnar styloid is a very common area, and then the thumb. The thumb is the #1 complaint patients have with the with the cast. So we'll put that there. All right, how does this feel? Not too tight? Anything bothering you?
Sorry, it's like the cotton just makes me cringe.
Oh, sorry. We'll cover it up. We'll cover it up.
You volunteered.
All right. So you'll use a 3-inch for this. Wet. All right, so same thing. I like to start again at the wrist, and I'm gonna make that there. Like that. Now, for me, I work my way up here, and you want to get to where like that palmar crease is, because we want to make sure that the patient can do this, right? So then I'll come wrap around to the base of the thumb. All right, when I come back up again, though, I'm gonna make a slit almost to the edge. You're gonna twist, you're gonna come up, and then you're gonna come down. And I'll explain that again. So here, you're going to let that kind of fold over, wrap that around. So once there, okay, come up at an angle, cut down all the way, almost to the edge, twist, and come here, okay? And once you're there, then you'll come and grab that, so you're tucking that in, and then I work my way down here. And remember, this is your base layer. Or this is what I call the base layer. So twice around there. And come up. And you don't have to finish it, like the roll, if you don't want to. It's completely up to you. Alright, so I've got my base layer on. Make sure it's as pretty as possible. Okay. And then now we're gonna get our pretty layer going. And your pretty layer, or your last layer essentially, is where you're gonna fold these guys. Alright, so we'll make sure that we get that guy folded. And if you have a little bit of extra material here, I usually just cut it. And then the same thing. Catching that there. Catching that there, coming up. So I'm gonna get the base of her thumb. I could probably come up a little bit more. Add an angle here. Okay. And then you're gonna twist. And come here. This guy, you'll fold him down. And you'll come that way. And then you wanna catch any little cast padding that might be up. So I'm gonna try to use just one here so you guys can see, but we're gonna come roll it half, all the way down. And then we're gonna grab this guy and bring him up. And use that to catch. And essentially, if you wanted to, she has a little bit thin of a cast padding right here, so I could have gotten one more over. And then we'll get our soap, gel, whatever it is that you find. For now, we'll just use hand sanitizer. And then you want to smooth all of that out, especially your edges. Now, for a distal radius fracture, same thing, right? You always want to use the palms, and then you can mold it a little bit. So what I'll do is I'll use the rule of threes. I'll use my palms and I'll use my thumbs to create like a little of an indentation right here. That's the only time I'll ever use my fingers, is to create a little indentation right there. And then sometimes with distal radius fractures, you'll need to reposition them so that way they don't get a wrist drop. So I'll push up that way. Okay, so I'm using my palms. It's the 3 points. Palms here, your kind of like the base of your fingers here on the other side, and your thumb. So I'm gonna have you turn. There you go. And show them. So I'm doing this. Okay, so we're squeezing to bring that up. All right, can you feel my pressure a little bit? Is that okay?
Mm-hmm.
Okay. So you never want to like grab. You want to make sure you use your thenar, the bases of your thumb, and your thumbs to push up. And then create like a little bit of a mold for her right here. And then there you go. So one of the things, like I said, I could probably put a little bit more here. One of the things that patients will complain about is the cast padding or the cast material at the thumb area. So you want to be real careful with that. Like right there, that might bother you. Can you do this for me? Perfect. Perfect. Can you do that? Okay. pad here. Yep, exactly. You'll have the patient with their toes up, rule of halves. Now here it is just as important to make sure that all the bony prominences are covered, because I would say splints are the more common areas that people end up getting skin tears and pressure sores. So. Oh, that's okay. I'll just work with this. That's fine. Thank you. We're gonna show them real quick. So, layer it on.
Is it okay that there's one gap with the heel?
Yeah, I'm gonna get that. Thank you.
Working with 2 inch on the leg, it's kind of.
Yeah, it's, you work. Yeah, I'm like, oh, work with what I got. All right.
Okay. I don't mind
Should go up there and
Yeah, I really could. Not the whole way. Maybe to like that door.
All right.
it's pretty impressive.
So once you splint that on, you're going to make your splint, and basically it's like a long sock, almost. You can always measure the patient here. You can always eyeball it, but you will.
In the lab, we have these, so you can use them to get a better idea.
Yeah. So your splint wants to be from the base of the toes all the way to the back, almost around that fibular head, not to where that popliteal fossa is, okay? Because that will bother the patient. So, now the splint also, when you put it in water, it does expand a little bit. You can pull on it, it'll make it a little bit longer. So, just keep that in mind when you're measuring. You may be off just a tiny bit. I'll give you this.
Make sure with this, when you're done, these things need to go on like right then and there because they get hard just like the regular cast. You fold this kind of in to get it away from the air in the edge, then you sandwich the bag, close this thing.
All right, and always use gloves with casting material or fiberglass or plaster because your hands will get very, very, very sticky and make it very hard to do anything else. So you'll take it out just like I did. This is the only thing that you'll get wet.
By the way, that's a big mistake that a lot of ER providers do. Most ER providers get the whole thing wet, the cotton and the fiberglass. So you might see your preceptor do that. Don't correct them, but just keep in mind that the ortho PA told you not to do it that way.
Yeah, because then you're gonna be there forever, and then you're gonna create wet skin, and then the surgeons won't like you. All right, so you place it on, and I don't know if you guys saw me, I kind of pulled it a little bit. That's to expand it, make it longer. And you can also make this cotton part longer as well. You'll fold it over, tuck it back in. All right, it's got some like Velcro-like substance inside to where you can make it like so. And then you're gonna come right to the back. So we're gonna come here, and we're gonna come here, bend here for me. Okay. Now, I've been doing this to where I kind of use my body already, so I'll use my leg and kind of hold that there. And then, I got it, don't worry. Yeah. Thank you though, thank you for your help. And then, I'll come down. So this isn't as important whether you start down or up for the splint as it was for the cast. Just in my opinion, as long as I have some form of anchoring so I can work with the other half. So we'll do one here, and then go ahead and relax. And then you want to make sure that the heel is on there, and then I'll come You can get really fancy with it if you want to do a figure 8. Just as long as the splint is covered. And then, same thing with the cast. You want to make sure that you keep the patient up at a 90. Relax your leg for me, and you'll come this way. Okay, this might be a little bit too short for you, but essentially that's the gist of it. Okay, same thing, this will get hard just like a cast will. Okay, and once that is done, then you allow the patient to relax.
All right, well, thanks for joining us on this casting and splinting walkthrough with Sarah Barlow. We hope these demonstrations and equipment tips have helped you feel more confident when applying these orthopedic skills in practice. Don't forget to like and subscribe or share what you found if this was helpful, and we'll catch you in the next video.